I'm Andrew Harvey, Chief Executive Officer of the Western New South Wales Primary Health Network. We were established by the Australian Government. It went through a competitive tender process, establishing one of 31 PHNs around Australia, and our job is to plan and fund health services, primary healthcare services. So that's our principal role. So we need to understand what the needs of our community are, and then from that we decide on what the priorities are, and that becomes the basis of our funding to services. So we're a commissioner. So a commissioner means planning and funding and assessing whether we got value from what we've funded. The other big role we do is working with general practice and Aboriginal community controlled health organisations. And that's about supporting them in their work, supporting or any number of things around their practice, around workforce, around digital health. So that's another really important role that we play. Well, our region, PHN region, is around about 450,000 square kilometres, takes in 53% of the state. So it's one of the most remote regions, PHN regions in Australia. And to do our job effectively, we need people in various places around our region. So we have our head offices in Dubbo, we have our offices in Orange, Bathurst, Berg and Broken Hill. And so we have staff across our region working in those offices. We're not a big organisation staff-wise, we've got less than 50 people. Because we're a commissioner rather than a deliverer of services, we fund others to do that. So indirectly we employ hundreds of people. Our actual company is called the Western Health Alliance Limited, and it's governed by 9 directors, and they meet every couple of months to talk clearly, oversee the organisation, the accountability that I'm expected to achieve, things that I'm expected to achieve as a CEO. And it's a very proactive board, a good board that's representative of our region. The company itself is a company limited by guarantee. So it's got members, a small number of members that form the governance of the company. Well, our underpinner is Aboriginal Health. And as an organisation, that's why we were formed, this unique partnership between mainstream and Aboriginal health providers. Health organisations. I mean, that's a really critical focus for our PHN, is closing the gap, and everything we do every day has to be about contributing to improving health outcomes for Aboriginal people in our region. So that's a big driver of our work, and we fund services. We also support work around cultural safety, work around advocacy for putting extra resources into support Aboriginal health services, and ensuring that there is a voice for Aboriginal people, strong voice for Aboriginal people in our organisation. So that's the number one priority. Another thing we do is around working with our local health districts. We have 2 in our region, Western New South Wales and Far West local health districts. So a really important part of our work is to align what we do with their work in our region, and they're state funded. We're Commonwealth funded, so it's a great way of working across government agencies to get the best outcome for our region. And we also work closely with Rural Doctors Network New South Wales, which is the workforce agency for the state. So we've got this great collaboration around things like first 2,000 days of life, which of course is early intervention for children and families. So that's a big focus. Workforce is what I alluded to. Digital health, closing that digital divide, and using digital health in a whole range of novel ways and to actually improve access to health services. Aboriginal Health I've just talked about, that's a big collaboration. And again, ensuring that we have, as an organisation, a fit for purpose PHN, to ensure that we're doing the right things in the right place at the right time, and also looking at how we can add value to our communities. Look, I love rural and remote communities. I have a connection with the land from my background, and I think it's great that you can give back to communities through these roles. We receive government funding, Australian government funding, to deliver our programs, and then we have to make decisions based on need as to where that funding goes. But it is great to be able to work for an organisation like ours, which is a not-for-profit, to actually invest back in those communities, and every day you get out of bed you think you're making a difference to the lives of people in our region, and I hope indirectly we do. So that's really what drives me, and look, working with a wonderful group of people who are just as passionate as me about making a difference in Western New South Wales.